Human papillomavirus, abbreviated as HPV, is the virus that causes cervical cancer in women and genital warts in men and women. It's a virus that can be transmitted through sexual contact. During intercourse or oral sex, HPV can make its way into the genitals, mouth, or throat and cause infection. Sexually transmitted HPV comes in more than 40 different varieties. The type of virus you get determines how it affects your body. Certain types of HPV cause genital warts. Other HPV types can make your cells turn cancerous. You've probably heard of cervical cancer being caused by HPV, but it also causes less common cancers of the vulva, vagina, penis, anus, head, and neck. What's tricky about HPV is that it doesn't show symptoms. You won't get a sore throat or a fever to let you know that you've been infected. In fact, you might have absolutely no idea you've been infected until you develop genital warts or have a positive pap test. And that's a test that is used to test for cervical cancer. Though HPV might not be as well known among STIs like herpes or syphilis, it is actually the most common STI. If you're sexually active, you have a very good chance of getting infected with HPV at some point in your life. That's why immunization is very important. The HPV vaccine effectively prevents against HPV types that cause cervical cancer and also prevents against genital warts. HPV vaccination is more effective in children in childhood and adolescence, but adults can also benefit from the vaccine, from the HPV vaccination. So why should adults get vaccinated with HPV vaccine? HPV infection is extremely very common. Most sexually active people will get infected with HPV at some point in their lives. The infection spreads easily amongst infected partners, and the infection usually causes no symptoms but can cause genital warts and anal cancer in both men and women, and can also cause throat cancer. In women, HPV infection can cause cells in the cervix to grow abnormally. In small fraction of women, the HPV induced changes will develop into cervical cancer, and about 12,000 women get diagnosed with cervical cancer each year, of which 4,000 women die from the same condition, which is absolutely bad and sad. The HPV vaccine prevents infection by the HPV type responsible for most cervical cancers. Up to until 2017, there were two vaccines available, that is Gardasil and Gardasil 9, but in most parts of the world now, the vaccine that is used is Gardasil 9. Gardasil 9 prevents infection by HPV types as Gardasil. We have HPV 31, we have HPV 33, HPV 45, HPV 52, HPV 58. So collectively, these types are implicated in 90% of the cervical cancers. In October 2018, the FDA approved Gardasil 9 for everyone ages between 9 and 45. HPV vaccines are extremely effective at preventing infection by HPV types they cover. HPV vaccine reduces a woman's risk of getting cervical cancer and precancerous growths substantially. Men cannot develop cervical cancer, but the HPV vaccine may prevent genital warts, penile cancer, anal cancer, and the spread of HPV to sexual partners. Gardasil 9 is approved for males ages 9 to 26 years. So when should adults get the HPV vaccine? The best time to get the HPV vaccine is before you've started having sexual activity. That's why the CDC recommends that both boys and girls get their vaccination at the age of 11 and 12, although they can get the vaccine as early as the age of 9. If you are 13 or and older and you haven't been vaccinated, you can still get the vaccine. It is recommended for the people through the age of 26. Some adults ages between 27 and 45 may get the vaccine after talking with their doctor. How many shots of the vaccine do you need? The CDC recommends 2 doses of HPV vaccine at the age of 11 or 12 years. The second shot should be given between 6 to 12 months after the first. If you can get all shots prior to the age of 15, only 2 are needed. 3 doses are needed if you get the first dose on or after your 15th birthday. And for people with weakened immune system, the second dose should be given 1 to 2 months after the first dose, and the third dose should be given in 6 months after the first dose. So what happens if you already have HPV? Will the vaccine treat it? If you have a current HPV, the vaccine won't get rid of it. But if you have one type of HPV, the vaccine may prevent you from getting another type of the virus. There is really no way to treat the virus once you have it, although there are treatments for diseases caused by HPV such as genital warts and genital cancers. This is why you should have regular pelvic exams and pap tests if you are female. Screen for cervical cancer like regularly. And then many people ask themselves whether the vaccine will protect them for life. The vaccine appears to offer long-term protection from HPV, but then even women who have received the vaccine should see their gynecologist regularly for a pap test to check for cervical cancer. The vaccine doesn't protect against all HPV types that can cause cervical cancer. If you missed part of the HPV vaccine series, talk to your doctor about getting the missing doses. And then the next question is the vaccine safe? Vaccines have to be tested before they can be widely distributed. The HPV vaccines were tested on thousands of people and shown to be safe before they were released to the public. The vaccines have been used for years now, and experts say the chance of them causing serious reaction is very, very, very slim. The HPV vaccine does not contain mercury or preservative. I don't know, there is another preservative they usually use, but it doesn't have it. Another question may be, if I get HPV vaccine, is there a chance I could get HPV from the vaccine? The part of the HPV virus used in both vaccines is inactivated, not alive, so it can't cause actual HPV infection. And then are there any adults who should not receive the HPV vaccine? Certain people should not get the HPV vaccine or should wait before getting it. Anyone who has had a life-threatening allergic reaction due to a previous dose of the vaccine should not get the second dose. Then anyone who has a previous life-threatening allergic reaction to an ingredient in the HPV vaccine should also not get the vaccine. Pregnant women shouldn't get the vaccine. Anyone with a moderate or severe illness, people who feel like mildly ill, may receive the HPV vaccine. And then, what are the risks and side effects of the HPV vaccine? In clinical trials and in real world use, the HPV vaccine appears to be very safe. More than 40 million doses of the vaccine, mostly Gardasil, which was approved in 2006, have been given in the US. And Gardasil 9 was approved in 2014 and is now the only HPV vaccine available in most of the developing countries. From 2006 to 2014, there were about 25 reports of HPV vaccine side effects. Over 90% of these were classified as non-serious. So the most common side effects of HPV vaccine are minor. About 1 in 10 people will have a mild fever after the injection. Then about 1 person in 30 will get itching at the injection site. About 1 in 60 people will experience a moderate fever, and these symptoms go away quickly without treatment. And then other mild to moderate side effects resulting from the HPV vaccine include nausea, which is common for almost all medications, fainting, headache, and pain. And then severe side effects or adverse events are uncommonly reported and have included blood clots, seizures, chronic inflammatory syndrome. But then research could not identify the HPV vaccine as the entire cause of the severe adverse events. So that's all for the HPV vaccination for adults. Hope you learned something. So I hope I have addressed all your issues, all your questions about HPV vaccination in adulthood. And if you found this video very helpful, please give it a like and don't forget to subscribe. I'll see you in my next video. Bye.